briefing. I'm Linda Raines, CEO of the Mental Health Association of Maryland. Thank you all for being here today. We've come together for this event for nearly 70 years. And I have to say, this year I found myself wondering just how exactly to kick us off with all that's going on in the world. And for some reason I found myself thinking about some old phone messages I used to have on my office landline. Wish I had thought to save them. One was from my dad. He always drove us as kids to work hard, work fast, work long, use our brains to do something that matters, which was kind of a perfect setup for the kind of work we all do, wasn't it? This particular message from him started with a long pause, and then I heard his gravelly New Yorker voice, "I don't leave messages, click." And that was it. Impatient was another one of his special qualities, and frankly a useful one when you're trying to drive the kind of change that we try to change in our line of work. The second message was from a guy named Ronnie. He had called to get help for an appointment at the North Baltimore Center. As usual, there was a backlog. He needed to see his parole officer in a few days, and he was looking for help, and I helped him figure out that problem. The message was a very long, heartfelt thank you for helping him to figure out his problem, telling me how he was working hard to put his life back together, how much he appreciated that tiny little bit of help from me. And honestly, it was nothing really. I was just doing my job, answering the phone, trying to help. And that, to me, is what all of you in this room are all about. Whether you're a consumer or a family advocate, provider, policymaker, or a policy implementer, all of you are making a difference and helping others through your actions. Lots of long hours, lots of hard problems, plenty of things to be rightly impatient about, things that make our brain hurt sometimes. The longer I've been here, the more I appreciate the opportunity to get together with all of you year after year and be in this room together, advancing the public good. I'm so grateful to have had the opportunity for such a long time to work with people who care and show it through their actions every day. Thank you all. For me, it makes the hard stuff a little bit easier, and I hope you feel that way too. And thank goodness it's not raining, sleeting, or snowing today like it was 2 weeks ago, right? Unfortunately, I do have a bit of unfortunate news to share regarding tonight's event. Dan and I learned over the weekend that Dr. Mary Olson, our keynote speaker, is sick and at the last minute found herself unable to get on a plane and fly to Maryland for our program. We are so very sorry that she will not be here with us tonight. Of course, we wish her a speedy recovery, but please accept our apologies for this last-minute change. I do want to let you all know we are going to reschedule the program. We'll do it sometime in the spring with her after session is over, and you all will be included. And last on that, for those of you who sometimes tell us in the annual evaluation that this event is too darn long, this year is for you. Anyway, we've had to juggle our agenda accordingly. Awards are going to happen at the end of the program. We're going to kick things off in a minute with a presentation from our friends at the Department of Health. But first, a few acknowledgments. I want to give a big shout out to our sponsors for supporting our programs through their generosity. Their names are on the screen and in your program. We couldn't do what we do without your support. I also want to take a minute to acknowledge our terrific staff. We're a resilient bunch at the Mental Health Association, but I will admit this year's event has been trying for us all. Our team has been rolling with the punches, planning the event twice. Now we're going to do it a third time in the spring. They're still smiling as we've navigated these bumps in the road. So can we give my staff a huge round of applause? Thanks, guys. So I mentioned one bump, but we actually had two this weekend. Late last night, we learned that the Lieutenant Governor is also unable to join us due to illness. So let's all send her wishes for a speedy recovery. And big thanks are in order for our first speaker, Deputy Secretary for Medicaid and Healthcare Financing, Ryan Moran. Ryan just had his Medicaid hearing across the street. He just had the Medicaid Advisory Committee. He somehow figured out a way to jump over here, do his talk for us, and cover for the Lieutenant Governor. So he has gone above and beyond today to help us out, and I can't thank him enough. Come on up here, Ryan.
Thank you, Linda. This is what I call a really bad backup, right? To be here. It's just so good to see all of you, and I just want to give everyone in this room a collective thanks for the work that you do. I know that your North Star is just like mine, and that is a relentless focus on the people we serve and Marylanders, and that could not be any more important than it is right now where we find all of ourselves. I also, Linda, want to thank you. Can we give Linda a round of applause and the team? I appreciate you, Linda. Always appreciate Linda calling me 7 o'clock, 8 o'clock at night. I got this thing we want to talk to you about. Always welcome those calls because I know that it's filtered through a voice of stakeholders just like yourself. And so I appreciate your partnership in all ways, both you and Dan. Before I begin, I do want to acknowledge that the Lieutenant Governor is unable to be here. She's under the weather. She's a bug that none of us want in this current time of peak sickness. And she sends her regrets, and she's offered that I share a couple of words for her to really show the appreciation that the Moore-Miller administration has, and to really thank the work of the Mental Health Association of Maryland and all of you here for your commitment to serve Marylanders with mental health and substance use challenges. The Moore-Miller administration remains deeply committed to addressing the mental health crisis, especially as it relates to our young people. Suicide is the leading cause of death among 15 to 24-year-olds, and that is really, truly unacceptable. And social and economic factors continue to impact access to mental health care, particularly in our most vulnerable communities across the state. That's why Governor Moore and Lieutenant Governor Miller have launched an attack on childhood poverty with the Enough Act that was passed last year, and the new Governor's Office of Children, and the ability to hold regular meetings with the Youth Mental Health Corps. The administration believes deeply that by working together, we can build a Maryland where every child has the support that they need to thrive. Additionally, this administration has made it a strategic priority to ensure world-class mental health services for all Marylanders. The administration also recognizes the budget situation that we are contending with in the state and understands the difficult decisions that will have to be made. This budget, as introduced by the governor and team, increases funding for mental health and substance use disorder programs, of which both Deputy Secretary Lord and I are going to highlight, but that includes $966.5 million for federally entitled behavioral health services for Medicaid recipients, $95.8 million in additional mental health and substance use disorder treatment for Medicaid-eligible populations, $419 million for mental health and substance use disorder treatment for those uninsured in our communities, and $5 million to continue providing grants to local behavioral health authorities. The administration stresses, on behalf of the Lieutenant Governor, how we are working with the community over the next few years to advance the shared priorities that I know that we all have in a fiscally responsible manner. I just want to take a couple minutes now to transition from those remarks from the Lieutenant Governor to talk a little bit about how the Medicaid program is working to ensure those commitments as well. Medicaid in its current moment here in the state of Maryland and across the country could not find itself in a most pivotal moment, especially when it comes to thinking about the services provided as the leading payer of mental health services in the country. Here in the state, more than 260,000 Marylanders in 2023 under the auspices of many of you received specialty mental health services, and more than 100,000 received substance use services. And today we're going to share some exciting updates of how the Moore administration is continuing to invest in behavioral health and expanding access to key populations under the program, including children and justice-involved individuals. And these particular access points that are created continue to be in lockstep with the overall larger vision of the Maryland Department of Health's effort to invest across different pillars and parts of the continuum of behavioral health care. First, I want to take and acknowledge the work that is critical to the future of the next 5 years for the behavioral health community, and that is the implementation of the new administrative service organization under Carillon Behavioral Health that launched on January 1st. The department, as you all know, contracts with an ASO to manage our behavioral health services with individuals with Medicaid and uninsured participants. It supports critical functions that's needed for claims payment, provider management, utilization management, and this is all done in partnership with both Medicaid and the Behavioral Health Administration at the Department of Health. Carillon, as you all know, is live as of January 1st, and their primary focus to date has been authorizing services and paying claims. Let me just talk for a minute about where we are in the transition. First, providers in this state, in terms of our oversight and monitoring this, you are not spreadsheets, you are not numbers, you are people who invest in communities, who employ workforces, who have payrolls to meet, and we recognize the critical importance of a vendor that allows us to enable us to achieve those goals. Carillon is 7 months, or 7 weeks, it feels like 7 months, 7 weeks into the transition. 7 weeks into the transition. Oleg Tokarski, thank you so much for your leadership and the leadership of the Carillon team. I recognize that across the continuum of behavioral health care, because I read every single one of the complaints that come through from an escalation tracker every morning. That's how I start my day in an Excel spreadsheet to get an idea of what's happening. I see everything that's coming through, and I will say that our oversight and monitoring on a daily basis, we have the utmost commitment to ensure that we resolve all the related kinks, system enhancements since go live. I recognize that some of you may not feel that this has necessarily been the smoothest transition. I can assure you that we are working to ensure every kink is removed and that we continue to stabilize operations at the department. Last year, you can clap for that. I grew up the son of a Holiness Pentecostal minister, so I'm used to that. Last year, I talked about school-based services as a way to expand access for children and youth in behavioral health, and that is why really proud today to say that as of January 1st, the department is now paying for mental health services in school settings for kids who have Medicaid coverage, ensuring access for every kid in the state of Maryland. The expansion allows for local education authorities to offer behavioral health services to all students, regardless of the setting, and ensures that the services include diagnostic evaluations, individual therapy, family therapy, and group therapy by licensed psychologists and social workers. I also want to note it's critically important that we work collectively across the full continuum and ecosystem of behavioral health providers to ensure a continuum of care of services for kids, regardless of where they might need it in our schools and in community. This particular initiative is bolstered by $2.5 million received under the Biden administration that was awarded to the department. We are collaborating with the Maryland Department of Education and statewide coalition of resources to ensure that we roll out this particular important work. Another population that Maryland Medicaid has sought to support is those experiencing incarceration. In January, Just before the end of the Biden administration, I think we became the 13th state in the country, I may have that number wrong, to receive approval for an 1115 waiver that would provide services for incarcerated individuals who have substance use or serious mental health for up to 90 days before they leave incarceration. We're hoping, in consultation and in partnership, to begin that work in the next fiscal year. The pre-release services under this program will include comprehensive case management, support for medication-assisted treatment, and counseling and prescribed medications for up to 30 days post-release. Critically important and a significant win for Marylanders. To implement this initiative, we are also working very closely with Corrections and Public Safety as our state agency partners. They have been extraordinary in this regard with us, with regard to this. And this particular 1115 waiver process was jointly approved. The reentry was jointly approved with our statewide expansion of Assistance in Community Integration Services program that will enable our department and our state to provide services, intensive housing, tenancy-based case management services, a pilot program in 4 jurisdictions, Baltimore City, Cecil, Montgomery, Prince George's, that will enable itself to go statewide. Huge win in terms of state investments in health-related social needs to serve some of our most vulnerable Marylanders experiencing housing insecurity. I'll just close by saying that these investments, we are laser-focused as a Medicaid team, the 700 folks that work for Maryland Medicaid and in partnership with the Behavioral Health Administration, jointly at the hip to ensure that we're supporting mental health and substance use services. It is an essential part of our mission, a core part of our mapping of a strategic plan for Medicaid to really create and support a coordinated behavioral health system to line. I would also be remiss if I, also did not mention the significant changes that are happening at the federal level and what those challenges may be as we lie ahead. We remain committed. I encourage you as an active citizen and participant in the community to watch Medicaid's budget hearings. We spend a significant amount of time discussing these particular implications, the work that we are doing in terms of to protect the programs and the best interests of Marylanders. Whatever may come this year, I can ensure that we as an administration look forward to partnering with the legislature, with all of you as stakeholders, to continue to strengthen and expand the access to services and coverage for all Marylanders. So on behalf of the governor and the lieutenant governor, let me just say we welcome your ideas, your thoughts, and our door is always open. Thank you.
Next, we will hear from our Deputy Secretary for Behavioral Health, Alyssa Lord. She's going to give us an update on what's going on at BHA. I do want to call out some thanks for one in particular, and that is the submission last week of the 1915I waiver for kids, something we kids advocates have been fighting for a long, long, long time. I just want to say we all are so appreciative of the progress on that that you and your team have made to increase access to wraparound for kids. Thank you, and come on up.
Good afternoon, everyone. Nice to see so many familiar faces. So I do want to start by recognizing that Linda's calling Ryan at 7 or 8 o'clock at night. Linda's calling me at 7 or 8 o'clock in the morning. So somehow I drew the early calls. Ryan got the late calls. But what I do think it shows is MHA's relentless dedication. But it also means that Linda's probably not getting much sleep. So on behalf of the Behavioral Health Administration, thank you to MHA for this absolutely important annual event. And we wanted to spend, as Deputy Secretary Marianne alluded, and so did Linda, we want to spend a few moments discussing the work that we're doing within the department, along with a broad swath of stakeholders that has transpired over the last year to build and rebuild the behavioral health continuum of care for our kiddos and their families. We know that there's more work to be done to enhance a system of care for youth and families, and the department looks forward to continuing these critical efforts. There's literally not a day where myself, Deputy Secretary Moran, and others within the department and external to the department aren't talking about this. And I think you all are coming to see with the submission of the 1959 that a lot of the work that the department is looking to do is focused upstream and ensuring capacity for home and community-based services. This doesn't negate the other levels of care, but our hope is to help stem the tide of our kiddos that are crashing into our emergency departments. And as Linda mentioned, on February 17th, it certainly was an important and monumental day, but the Medicaid team, in partnership with BHA, submitted the revised 1959 state plan amendment. And sincere thanks to you all that have participated over the last 6 months or so to provide feedback. It very much does take a village. A couple of key highlights from the submission include addition of youth peer supports to expand available resources, increased service capacity to reach more youth in need, so a ramp up of being able to serve up to 1,800 youth over the next 5 years, extended plan of care review periods for a more efficient and thorough assessment process, lowered eligibility criteria to improve access to care, so there's no longer 47 assessments and 19 evaluations and 32 authorizations and having a score of 400 to be able to enter the program. And then preservation of the Telehealth Access Act to maintain remote service options. Secondarily, the department has been partnering with the Maryland Coalition of Families and MHAMD Health to develop recommendations through a public-facing roadmap that offers a vision for change for the state's public behavioral health system. The partnership will establish the next steps to improve behavioral health for Maryland's children, youth, and families. The roadmap has a couple of core tenets. It is a tool intended to support BHA's decision-making and strategic planning in the coming years. It offers a vision for how Maryland's public behavioral health system could better help children, youth, and their families to thrive even as they confront behavioral health challenges, and describes 5 high-level goals and 10 specific strategies BHA could pursue to achieve this vision. And while it's slated, while it's saying it's BHA, it's really not. It very much cuts across a number of state agencies as well as community partners to make this a success. It was also developed in response to the need for urgent reform. In the year and a half that I've been here, there has been a lot of conversation about our youth and our families. And as a proud mama of a 10-year-old who struggles day in and day out with PTSD and anxiety and trying to connect her to care, I personally have embarked upon this with a very different lens and want to make sure that we're holding up the mantle. And so with that, it will be released in the spring. Don't ask me the exact date, but it's coming. And we also know that this session, there were several pieces of legislation that have been introduced with the tacit agreement that Maryland youth and families deserve quality and equitable behavioral health services. And to quote Martin Luther King, I think we all need to bring back some Martin Luther King into our daily existence in light of what's going on. You don't have to see the whole staircase, just take the first step. And collectively, we are taking those steps, and sometimes 2 or 3 at a time, because it is the right and necessary thing to do. Thank you.
All right. Well, thank you. Alyssa, Ryan, I really appreciate you being here, and thank you for your support and your partnership. And thank you all for being here. My name is Dan Martin. I'm the Senior Director of Public Policy at the Mental Health Association of Maryland, and again, really thrilled to just have everybody here. I'm kind of going to MC the legislative briefing portion of the event tonight. We have a couple of our partners from the legislature here now that I'm going to introduce in just a moment. And we're expecting some more to come through, and I'll also kind of fill in the gaps where they are some. But I just want to start by saying that, we have a really ambitious agenda this year at the Mental Health Association of Maryland, together with our coalition partners, many of whom are here right now. Despite the budget situation that's going on right now, there's a lot of unmet need out there, and so we're working to fill that need. At the same time, we recognize and understand the challenging budget situation that the state is facing, and the challenge that this poses for policymakers. And we really believe that our advocacy is more impactful and more effective when done in partnership with our partners in government, both at the administration level and in the legislature. And so, I've said it all session long that we really commit to everybody to working in collaboration with our partners in government to get these things done in a fiscally responsible manner. And so I'm going to, we're going to go through a little bit tonight on what they're kind of go through some of the kind of priorities that are in the Behavioral Health Coalition's agenda and the Mental Health Association of Maryland's agenda. Like I said, we have a lot. It's really ambitious. We cover issues that address the workforce, that address parity and equity and services reform, that address the crisis response system. And I'm going to start with, some of our parity and equity and services reform initiatives. For those that are unaware, there have been 8 national studies from 2019 to 2023 that have demonstrated blatant systemic inequity in access to behavioral health care, with Maryland's data often among the worst in the nation. A report that came out in April 2024 documented that Marylanders are nearly 9 times more likely to go out of network for behavioral health care versus primary care, a rate that's twice the national average. Marylanders are also nearly 21 times more likely to go out of network for inpatient behavioral health care versus inpatient medical surgical care, a rate that is 3 times the national average. And Maryland in-network behavioral health clinicians are reimbursed 23% less than other doctors performing similar services. And so, we have a lot of strategies and a lot of, things that we can be doing to address these challenges. One of them relates to a bill that we're prioritizing this year that is being sponsored by our first legislative speaker, Senator Clarence Lamb from Anne Arundel and Howard County, would address issues related to prior authorization and step therapy protocols and fail-first protocols for prescription medications that are being used to treat serious mental illnesses. And so this is a really important issue. Really really thankful to have such a strong sponsor for this legislation, and welcome Senator Lamb to come up right now and say a few words. And also, I think what we're trying to do and what he's agreed to do is that we're going to, if there are a few questions, if folks have a few questions afterwards, just raise your hand. Senator Lamb has graciously agreed to take 1 or 2 questions before he has to skate out of here for an Executive Nominations Committee meeting. Sure. So thank you so much.
Thanks, Dan. Well, good afternoon. Thank you for that overly generous introduction, Dan. I appreciate it. It's good to see everyone. Good to see our colleagues from the department as well. And obviously a lot going on this session, but happy to be here. I know that we're talking about the hours that are spent down here and all the work that we do. I'm a physician, and I still see patients every week. And so I was just in the clinic this morning from 7 a.m. till noon, and then come down here, do all the work that we need to do down here as well. And so someone's calling me, call before 7 a.m. because otherwise I'll be in clinic already. But it's important to kind of bring that perspective as the only physician in the Senate to understand and see what our patients are going through, see what you all in the community are going through, who other providers, challenges that other providers see as well, I think is incredibly important. And so consistently try to bring that perspective to the General Assembly and share the important work that MHA does, and thank you for the invitation to be here again to help advocate for this important bill, but also to be able to share with our
our colleagues, there's perspectives that you have as well. So certainly this is an important opportunity for you to reach out and continue to have that dialogue with all of us in the General Assembly also. Dan touched on an important bill that we are working on. It's a bill that we've been working on for the last few years regarding step therapy. Step therapy, as many of you know, is an insurance cost-cutting measure that requires patients and their providers to have to go through many hoops in order to get the drug that they need to be approved by the insurance company for their coverage. This may be a drug that they were on before, but because they changed insurance companies, they have to start all over again. Basically, that's where the name step therapy comes from, because they may require you to step through many different other drugs to get back to the drug that used to work for that individual, or it's also known as fail first therapy, that if you switch insurance companies or you switch jobs, that they may require you to fail these drugs first before you can get back to the drug that your physician or provider had you on before. We passed a couple years ago a bill that I had sponsored into law, some guardrails and some limitations in terms of how fail first therapy or step therapy could be established here in the state. But what we also did as part of that legislation a couple years ago was exempt out any mental or behavioral health conditions for the obvious reasons. For the folks who are in this audience, you all know why that should be. That the last thing you want is someone who has found a psychiatric medication that works for them to have to go through or go back through medications that didn't work for them just to be able to get back to the medication that did. It makes no sense at all. And it's really difficult to have to explain to these patients that we have a medication that we know works for you. You tried these other medications already in the past that didn't work for you, but the insurance company is requiring us to go through all of these medications again just because you may have changed your insurance provider. And so we unfortunately did not have the ability to pass that exemption within the first bill as it was passed into law a couple years ago. So we've been trying over the last couple years to have this exemption for mental and behavioral health conditions to not have to go through step therapy. And it's been really, really challenging. And so we have that bill again before the General Assembly this year. Hopefully this is the year that we will get that passed. So we appreciate the support of MHA and so many others in this room who have helped advocate for that important piece of legislation. And it's something that we will continue to push because it is really, really important for us to be able to help these individuals who know that there's a medication that works for them to not have to jump through all these hoops. And oftentimes, as you know, you have a very small window by which to be able to ensure that someone is either compliant with their medications or willing to take their medications or willing to even accept treatment. And any delay in that is really, really detrimental. And when it comes to step therapy, it really just makes no sense in the mental and behavioral health space. So hope to continue to have your support. It's one that we'll keep pushing on as well. A few other quick issues, because I know Dan had suggested kind of touching on a few different things. You probably have all heard that we have a significant emergency department wait time issue here in the state of Maryland. We are either number 49th or 50th in the country. That is not obviously where we want to be. And so we have a real concern when it comes to the number of individuals that are coming through our emergency departments, and it's a very difficult problem, and there are many reasons for it. So this is not just isolated to the emergency department. It could be inadequate primary care, it could be inadequate ability to be able to discharge folks to proper skilled nursing facilities or assisted care facilities and the like, all things that we continue to work on. But we also know that a lot of the need in our emergency departments are due to mental and behavioral health conditions or crises. And so that is something that we need to continue to look at, to unpackage, to figure out how we can provide adequate resources and support, as well as additional beds, right? And so we know that for many of these folks that are being boarded in emergency departments, it's really unconscionable when the help that they need is not available for them. And I think for us, we continue to help support and recognize the need for additional mental and behavioral health beds. Psychiatric beds are just inadequate out there throughout the state. And while the state has been downgrading the number of psychiatric beds we've had as part of of our state system, we're still trying to elevate the need to be able to have a comprehensive plan to be able to account for loss of beds, for the growing psychiatric need that we see. And so this issue will continue to be at the forefront of a lot of the discussion when it comes to emergency department wait time and the need to be able to address these psychiatric patients that need beds as well. Over the interim, in the last summer, we had a audit that was reported out by our Department of Legislative Services audit team, who looked into some of the mental and behavioral health services that were offered at our state corrections facilities. And we know, and this audience also is well aware of the fact that oftentimes, unfortunately, our correctional system is a revolving door with our mental health system, that folks cycle from one side to the other side because their needs aren't necessarily being met. They have behavioral health crises. They end up in the correctional system, which is unfortunately not where we want them to be. But they need to get the help that they need. And what this audit found was that in our Department of Public Safety and Correctional Systems contract, when it comes to being able to provide medical and behavioral health care to those who are in our state jails and prisons, it is wholly inadequate. They just simply don't have enough providers that are there to be able to meet the need that's there. And so there's an open question whether these types of contracts are in the best interest of the state, whether they're structured properly to be able to ensure that people that are in the correction system get the help that they need. Because at the end of the day, most of these folks that are in our correctional system are discharged at some point. They're able to go back into the community. And it's important and incumbent on us as a state to make sure that they have the resources to be able to be supported and the care that they need so that they can become productive members of society once they leave the correctional institution that they're at. And so we're continuing to look at that as a state as well to see whether those types of contracts with these are private healthcare providers in our correction systems is the right way to go. So open discussion on that. Last bill I'll touch on is another one of my bills on self-directed mental health services. This is a pilot program. Some of you may be familiar with this as well. This would set up a pilot program within the state to have 100 individuals be able to be provided clinically appropriate, patient-centered, culturally responsive, and trauma-informed, self-directed wraparound care for them. All really, really important. And if we were able to secure the funding for this in the state's budget, which I know is tough these days, I think there's about $300,000 that would be allocated in this bill for that purpose. There would be a $300,000 match from the Center for Medicare and Medicaid Services to provide a total of $600,000. Open question whether that's enough to support, the individuals that would be the 100 in this pilot program, and obviously still having conversations with the department as well. But that's something just, again, that I'm working on that I think we all recognize there's tremendous need for. We're all here to try to help. The challenge is always in the resources and the availability of funding. So with that, let me pause there, but I do want to congratulate Lori. So I noticed that you were one of our awardees for today, somebody who spent decades of time down here in Annapolis with Mosaic and community behavioral health in the old part of my district in southwest Baltimore County, but just a phenomenal advocate for this community. So just again, congratulations, Lori, on this recognition. Really, really important. So thank you. Sure.
There's a mic, or you can just
I can just talk really loudly, that's all the time. I'm Katie Rouse, Executive Director of Honor of Maryland. We're Honor Maryland's statewide peer network. I just want to say, Senator Lamb, thank you. You are such a champion for high-quality care that's delivered in a way that is based around choice and about that relationship between a person who's seeking support and services and their medical team. And just so thank you for the self-directed care work, for raising important questions about how we make sure that choice is protected and that people get the right care. But I wanted to say something, your comment about our ER wait times really touched me, because we know a lot of folks who go to the emergency room in a behavioral health crisis and don't meet the criteria for inpatient admission, and that's actually a great thing. People should not be in the hospital if you don't really need to be in the hospital. But so many folks, it might be half the folks who come to an ER looking for behavioral health support, don't have anywhere else to go. And I just want to recommend that things like self-directed care, recovery support services, peer support services, peers who are working in our hospital system, our mobile crisis teams, our urgent care, many of which are grant funded, provide such important services so that people can learn that there is an alternative to the emergency room where they can actually get better quality care. So thank you for all your work on this, and just any thoughts you have about how we continue supporting community-based services. Thank you.
Thank you. All really important methods of care that we have to, I think we recognize that patients come in all different situations and circumstances, right? And you have to find the right avenue and the right modality of treatment for them that fits, their background, their experience, where they are, what they need, and all of that needs to be kind of uplifted and kept at the forefront, that we need to have the variety and spectrum of services for all of these individuals while, paying attention to autonomy as well for these patients. And so it's always a tough kind of balance to juggle, but I think we as a state have tried to provide as much resources in those variety of circumstances and avenues as possible. I think we're obviously all very concerned about, what we're seeing at the federal level, potential rollback in funding, and at the same time, our state is in a really tough funding budget deficit situation. And so, to the extent that we can continue to uplift and support and elevate these services, we want to continue to do so, and hoping that at least at the federal level, these types of supports are not wound back. Good. All right. Well, thank you, everyone. Pleasure to be here. Thank you for your support.
Thank you, Senator Lamb. Appreciate it. I'm going to switch now real quickly to a different topic, a different priority for the Mental Health Association and the Behavioral Health Coalition this year, which is workforce. Data from an alarming new assessment on Maryland's behavioral health workforce, which just came out in October. It was completed pursuant to legislation that the Behavioral Health Coalition spearheaded in 2023 and was actually sponsored by our next speaker, the great superstar from Anne Arundel County, Delegate Bagnall. But that assessment came out, and it really highlights an escalating crisis in access to mental health and substance use care. According to the report, the state's current behavioral health workforce is 50% smaller than necessary to meet today's demand, and 45% of the existing workforce is expected to leave the field in the next 3 years alone. The report outlines a series of recommendations to combat this crisis, including a funding strategy for Maryland's Behavioral Health Workforce Investment Fund, which was also completed pursuant to that established pursuant to that 2023 bill. Given the budget situation this year, some of the funding strategies will have to be deferred, but there are things that we're doing this year, again, to advance address the workforce crisis in a fiscally responsible manner. We'll hear later about the social work compact bill that's really important to us. But something I'm going to invite Delegate Bagnall again up now to kind of talk about some of her bills. One of them is, efforts to fund community behavioral health workforce development and quality improvement initiatives. She has other bills related to advanced directives for folks with substance use disorders. So a lot of really good things happening. And again, I think Delegate Bagnall is willing to take a question or two after her comments too. So nice round of applause for Delegate Heather Bagnall.
This is always one of my favorite events of the year because I am so appreciative of the work that you do in advocating for our community who often suffer from not just trauma, but the stigmatization of their own disease. So this is a tough year. You all have heard it. But that doesn't mean that we can't continue to do things, really important things. I am incredibly gratified at the opportunity that I have. I'm the Public Health and Minority Health Disparities Subcommittee Chair. I have been able to champion really meaningful legislation for behavioral health and mental health and substance use disorder in the time that I've had here with some really great Senate partners. including Senator Augustine, who was my partner on the Behavioral Health Workforce Trust Fund, on collaborative care model, on the high fidelity community and home-based wraparound services, which are providing those services to our adolescents, many of whom are the very people that we're talking about when we say we have stuck populations borders in our emergency departments. This session, I'm working with the chair of our committee on a pediatric overstays bill, which will better coordinate our various agencies, our Behavioral Health Administration, the Department of Health, the Department of Human Services, our Maryland hospitals, to make sure that those adolescents that are in the hospitals and their somatic needs have already been met have a place to go. And we're hoping that that place is back home, because that's where they belong. They belong in their homes, they belong in their communities. We have to make sure that the services are there to meet their needs. But there are a few things that I'm doing this session that again, they're small but meaningful efforts, because we have the Healthcare Quality Fund. So as many of you know, we have a very robust behavioral health system as compared to a lot of the nation. And we have a really dedicated workforce. But occasionally we do have compliance issues. And we do have civil penalties for those compliance issues in an attempt to bring providers back into compliance. And currently those civil penalties, they go into the general fund. So we are working to create a fund so that those civil penalties will go into a dedicated fund so that we can reinvest that money into better behavioral health outcomes, into improvements in our system, into grants programs, so that those funds aren't just simply supplementing the Maryland budget, but they're actually supplementing Maryland care. Now, we're hoping that that's not a big fund, because it is civil penalties for noncompliance, but it does allow us to take that money and reinvest it into our behavioral health system. I'm also working on an advanced directive. As many of you know, we passed a behavioral health advanced directive a few years ago. We worked with Maryland CRISP, and they were incredibly helpful in making sure that that advanced directive would be meaningful, that it could follow the patient, from hospitals into community services. But as is often the case, the recovery community, the substance use disorder community, is often sort of left out of the conversation. So we are adding to that behavioral health advanced directive a non-opioid aspect to it, so that people who are in recovery or who don't want opioids can make their will known. And again, this is about patient choice, and this is about folks who are already dedicated to their recovery, not having to relitigate their own needs, that they can make their needs known, so that hospitals and community providers will be aware of if they don't want to be offered an opioid, or if they have a particular allergy to a specific level of opioid, that they can make that known in their advanced directive, so that if they are not conscious, or if they are in a mental health crisis, that their needs will be known in advance. Now, we do have an amendment for emergency situations. Obviously, if somebody is in the hospital and they need medication, we don't want there to be a delay in care. But this is just another opportunity for patient choice, so that patients can make their desires known. And I have one more bill I just wanted to mention, because it's on your priorities, and I'm quite excited about it. And it's the Interested Parties Advisory Group. And this is, again, looking at the Medicaid population and those community-based services, and making sure that we have a consumer perspective as we're making those decisions. And this was what, this is, as we're making those decisions regarding provider reimbursement rates, workforce challenges, and consumer access to care. Now, there's a couple things that are not my bills, but as I like to say, though my name may not be on it, my fingerprints are all over it. And one of the things that I'm very, very proud of, and we just passed it in the House, and I think it's already passed over from the Senate, is the preservation of telehealth. We've removed the sunset. And when I say my fingerprints are all over it, it's because when we were first working on telehealth, I worked specifically on the audio-only parity part of telehealth. As we know, telehealth isn't about the care, it's about the delivery model. And it was really challenging to get that message across, that it was not changing standard of care. It was not changing scope of practice. What it was doing was providing patient choice on how they wanted to receive that care, whether they wanted it to be in person, whether they wanted it to be synchronous, asynchronous, audio and video, or audio only. And that was really, really important, and I'm very proud to say that we retained the audio-only part of the preserved telehealth. So that will now become permanent in Maryland law. It's always an ongoing effort to destigmatize and advocate for investment, because we are, as we know, we are 40 years, I would even argue 50 years behind in investing in behavioral health care. And I think if there are silver linings to COVID, COVID ripped the lid off of that. I mean, it just laid bare how behind we were in really meeting the needs of our Maryland constituents. So I'm incredibly proud to stand here and be able to advocate, even in a year where we know funding is hard, but you're all here helping us do the right thing. So I want to thank you for being here, helping us do the right thing. And I'm going to make an ask for you to continue to help us to do the right thing, because I believe it's our next speaker is going to be talking about what is still considered a fairly controversial bill, and that is the Overdose and Infectious Disease Prevention Services. Now, we know the data is so clear on how essential this is. And I mention this because this week we will have the hearing in the House. But it's going to take everyone rowing in the same direction to get the House and the Senate to agree that this is a really good idea. It's enabling legislation, and it's going to make sure that we can keep our folks who are challenged with a substance use disorder alive until such time as they decide they want treatment. But it's not about getting them into treatment. It's about keeping them safe and alive. So I hope that you will help us make the case for how important this is and how non-controversial it truly is. And with that, I am happy to take questions if you have them, and I just want to thank you again for the opportunity to be here with you today.
So you mentioned the children on overstays in hospitals, and I'm really glad to hear there are some solutions being discussed, but I wonder about the 235 children who were placed in hotels last year who have similarly complex behavioral health needs and cost roughly $28 million.
And when we talk about the pediatric overstays and the legislation that we're looking at, it's working with the hospitals, but also working with the state agencies that are responsible for adolescents that are not just in the hospitals, but in the hotels. We are aware of that, and they are an important and essential component of this cooperative interagency effort, because they're not getting care in a hotel. They're not even getting the care that they need in a hospital. They're not getting access to education. They're not getting access to their fellow students. They're just stuck. And it's really important. We had a conversation about this recently, and I got a little ornery, I can tell you, because there was a question of whose responsibility were these adolescents. Which agency was taking responsibility? And I said, no. I said, these are our children. These are our responsibility. These are Maryland's children. And I want to make sure that is our overarching message. These are not the hospital's children or the department's children. These are Maryland's children, and they are all of our responsibility. So thank you for bringing that up, and yes, we will continue to make sure that all of our children are being taken care of. Thank you, everyone.
All right, this is going well so far. So, another big bucket on the Behavioral Health Coalition's agenda is crisis response services. So, as demand for mental health and substance use care has increased, and public awareness about Maryland's 988 helpline has continued to grow, the state's crisis response system has seen a steady rise in calls for service. I think the helpline got 8,000 calls last month alone. I don't know if someone from 988 here, but it's really, again, it's an important function, an important component of our system that we need to make sure that we're continuing to build out. Legislation introduced this session will continue Maryland's progress in building a comprehensive and equitably available system of supports to divert individuals in crisis away from hospitals and towards more appropriate levels of care. And so our next speaker, Senator Shelley Hedelman from Baltimore County. She has some legislation in this year to continue Maryland's behavioral health crisis response grant program, which is really helping to kind of fill gaps in care in places across the state as we transition from a more grant-focused system to a more Medicaid reimbursable crisis services. That's going to be really important. And as Delegate Bagnall mentioned, she's also sponsoring really, really important legislation around establishing overdose prevention sites in the state. And so I'm going to welcome her up right now to say a few words. Senator Shelley Hedelman.
Good afternoon, and thank you so much, Dan. I really appreciate the opportunity to be here and the opportunity to follow some great colleagues, Senator Clarence Lamb and Delegate Heather Bagnall, and you have Delegate Jamila Woods, and do I see some? Nope, I thought somebody else was just walking in. But I know I have looked at your lineup, and you certainly have had a wonderful array of different colleagues up here to talk about what's happening this session. This is a challenging session. I will tell you, I've been here, this is my 11th session, and I think this might be the most challenging so far. I'm going to actually talk opposite. Delegate Bagnall teed up the overdose prevention sites, so I wanted to talk a little bit about that first, and then I'll talk about the behavioral health crisis response grants. OPS, as they're called, they're not a new idea. This is an idea that is in place all throughout Europe and in many different countries throughout the world, and in nearly 200 different sites across the world, and there has never been an overdose. There has never been an overdose death affiliated with an overdose prevention site. So what are they? They are sites that are mostly community grown, and they enable people who use substances to come with their own substances and they can get an array of different kinds of services. I had the wonderful opportunity to go to New York with Chair Jocelyn Pena-Melnick and the cross-file of the bill 2 years ago, and we visited both sites in East Harlem and I'm blanking where the other one was, but anyway, 2 different sites in New York City that had been put together, and we had the opportunity to see people come and use drugs, and which I have to say was a bit of a startling experience for me, who does not have much experience in this area, but also to see the support that people were getting and the relationships that had been built between the folks who came, and many of them came a number of times. They got to know people in the community. The people who worked there were very highly trained people who knew what to look for in terms of overdose, who had mirrors and could watch people using, who provided clean needles and other kinds of services. They had housing folks there who could talk about finding stable housing. They had laundromat there where people could come and bring their dirty clothing and clean it. They had a room where they had cots laid out where people could take a nap. They had hot showers where people could come and clean themselves. They had medical professionals there who could look at wounds and help people take care of wounds. They had counselors there who could address the mental health needs of people. They had substance use counselors there who, when someone was ready to take the step to try and address their addiction, that they could meet with them and get connected to services that they so desperately wanted. But the important thing was that they were there supporting people where they were, right? We know that people use substances, and I would rather have them using them in a place like that is fully supported by professionals who are well-trained to know what to look for in terms of harm than somebody going in the McDonald's bathroom and overdosing in the McDonald's bathroom or in the public library bathroom where we know people are using, or in any number of other kinds of public places. So it's really meeting people where they are, taking a look and hearing from them what their needs are, developing those close relationships, and being able to address their needs. This bill, and this is, I don't know how many years now it's been, but I took it over from Delegate Dr. Dan Morheim when he left the legislature, and I was I think co-sponsor in the House, and then when I went over to the Senate, became the lead sponsor with the chair of the Health Subcommittee, the Health Committee, but at least 4 or 5 years now. And so what would it do? It would create a pilot program, 2 urban, 2 suburban, and 2 rural sites. You'd have to come only if you wanted it in your community. It's enabling, like Delegate Bagnall said. It is not an imposition from on high. It is the community in cooperation and coordination with their local health department, and local community organizations would have to want this, and they would go before the state health department to get permission to do so, and then bring together a partnership, whether it was a local health department or a federally qualified health center or a hospital or a substance use program, et cetera. And those groups would work with the community. I will tell you, in New York, when we met with On Point, they talked about how the local law enforcement was originally very much opposed to what they were doing in this. There's an apartment building on the corner, right across the street from the OPS site. And they were like, what are you bringing to our neighborhood here? And now the local law enforcement are some of their biggest supporters. They work really closely with them. The park on the corner where there had been dirty syringes and like tons of detritus from drug use is now cleaned up. They have been wonderful neighbors, and that is the kind of partnership that we're looking for here. So Mayor Brandon Scott is in support of this bill. He has made it one of his priorities this legislative session. His staff testified, and so we'll see. I'm happy to answer any questions you have about that. The second bill that Dan mentioned is Senate Bill 599. It's House Bill 1049, and it is cross-filed with Delegate Jessica Feldmark. And I see Daniel Rabbit over there, who brought it to me. And unfortunately, when he brought it to me, we thought we were going to be doing this in a future, in a way that would ensure that there was future funding. There has been $5 million in the budget since 2022, and prior to that, 2 years before, there was $3 million and $4 million for behavioral health crisis response grants. And this bill that we introduced would ensure the grants for 27, 28, 29. Little did we know, it wasn't going to be in there for 26. And so that is something that we are going to need to do as budget committees to see if we can find the money to address next fiscal year's needs. But these are very essential to the crisis needs of our localities. And I'll just give you a couple of examples. And I'm assuming many of you deal with this grant and know very personally what kinds of services it provides. But in my county, I know it helps to fund urgent care services. It helps to fund those 988 operators. It helps adult mobile crisis units in Baltimore City, in Calvert County, the crisis call center, youth and adult mobile crisis units in Carroll County, adult crisis beds in Howard County, adult substance use disorder observation chairs in Prince George's, adult mobile crisis services in Washington County. So those are just a couple. In walk-in crisis services for youth and adults in Frederick County. These are pretty essential services. It makes sense to me that in 2022, it got a bump to $5 million coming out of COVID. We all know, you guys live and breathe this stuff every day, how much needs increased post-COVID. And they haven't abated. They really have not. So I am happy to be sponsoring that bill, and we have a hearing coming up on that in the first week of March. On March 6th and in the House on March 4th. So welcome your support of those bills. My bill has already had, the OPS bill was heard in Finance a few weeks ago. It will be heard in HGO later this week, and certainly welcome your support on both of those bills. So thank you for your activism and for your service and for everything you do to keep us all healthy. Thank you. And I'm happy to take a question or two also, if there are any. Okay, I covered it all. Thank you.
All right. Moving on. Well, thank you very much, Senator Hedelman. So back to workforce a little bit. Like I said earlier, in the workforce, Maryland's behavioral health workforce really is in dire straits. Like, I'll just repeat it. It's 50% smaller than necessary to meet today's demand, and 45% of the workforce is expected to leave the field in the next 3 years. And so, what can we do, given the budget situation, in a fiscally responsible manner? One of the bills that our next sponsors, our next speakers coming up to talk about would enter Maryland into an interstate social work compact, which is one of the big one of the big, obviously, professions driving Maryland's behavioral health workforce. And another, I'll just kind of real quickly, we've been talking about a lot of policies that are kind of really being spearheaded by the Maryland Behavioral Health Coalition, but the Children's Behavioral Health Coalition, that's a lot of folks here are part of, is really doing a lot of work, has a lot of priorities too. Ensuring adequate funding for school behavioral health services is a big piece, and I'll talk about that a little bit later. But also, making sure that we are expanding our efforts around infant and early childhood mental health care. Making sure that we eliminate reimbursement and diagnosing barriers that prevent us from effectively serving our youngest Marylanders. And, we'll hear later from some of our awardees that have been really, really doing this work and champions of this work for years. But our next speaker, Delegate Jamila Woods from Prince George's County, has a bill to address this as well. So I'm going to welcome her up to say some words about these bills. Delegate Woods.
Good afternoon, everyone. I'm so glad to have this opportunity to be here with you at Mental Health Association of Maryland. I was born Justina Dorothea Stewart. I am the product of the hard work that you all have done to address urgent and critical mental health concerns. I was raised in foster care for the first 12 years of my life, in a place, in a space where I was supposed to be protected and taken care of and given opportunities in the foster homes. I received every form of abuse that you can think of: mental, physical, spiritual, sexual. Needless to say, my behaviors began to reflect that something was going on with me. But at that time when I was coming up, the question that was constantly asked was, what's wrong with you? But because of people like you who made up in your minds that we need to go deeper and we need to find out what's really going on, I graduated well into adulthood to the question being asked, what happened to you? I am in the legislature today because it is my desire, it is my goal, it is my passion to make sure no one has to go through what I had to go through. And so every time you call, I will be here, because mental health is such a serious concern. And we waited until it was chaotic and crisis. You didn't wait. But we waited until it was chaotic and in a crisis state to recognize that we had to do something. And so I want to thank you for being those organizations who said, no, we've got to stop here. We've got to come up with things to change the way we are dealing with people like Justina Dorothea Stewart, who changed her name to Jamila Woods because she thought that Justina Dorothea Stewart was a monster. Because every time as a child she looked in the mirror, she saw a monster. She did not see the beautiful person you see right now. She is beautiful, isn't she? Y'all can clap. It's all good. And so I'm here to help in any way that I can as a legislator to put forth the legislation, and thank you all for bringing it to us. Thank you all for coming together. Thank you all for being compassionate. Thank you all for recognizing that we do have the power, organize people, organize resources, making the investment to make a difference. Thank you. Give yourselves a hand. I'm here to talk about the urgency of now. As was said to you, I am a sponsor HB 1083, along with the cross-file by Senator Augustine from District 47, which establishes a work group to implement early and periodic screening, diagnostic, and treatment requirements. You see, when I came up, thank you, when I came up, there weren't services. There weren't people looking to see what do we do, how do we help young people. There weren't people who were committed to understand. There was no such thing as ACEs, early childhood experiences. There was no knowledge that what happens to people in their childhood follows them through their adolescence, follows them through young adulthood, follows them to adulthood. And so Jamila J. Woods was looking for love in all the wrong places, was looking for acceptance, just wanted to be someone that people accepted. And thanks to people like you, I'm here today. I'm not perfect. I'm gorgeous, but I'm not perfect. Come on, if you can't say amen, say ouch. You can't say I say boom shakalaka. I'm gorgeous, but I'm not perfect. But because I'm no longer ashamed to say that I have issues. I'm no longer ashamed to say that even at 60 years old, I had to go get some counseling, all right? I'm the person that your parents probably told you not to hang out with. Boom, shakalaka. But because we know now what we know, and we recognize the urgency of now, we want to make sure that those people who have been exposed to poverty, to violence, to neglect, to poor caregiver mental health, and other adverse childhood experiences have the opportunity to get the long-term help that they need, to help to work on those things that have formed the brains in ways that we would have never imagined. And it's not what was wrong with them. It was what happened to them. We do believe that we can improve outcomes for young Marylanders, and that's why I'm here to help support that bill. This bill is going to help to get that ball rolling. Your continued support, your continued passion is going to help this bill come across. Your advocacy, your testimony, your virtual, your written, whatever input you give is going to help us make this happen. And so again, I have to say thank you to you. The other bill that I'm also a sponsor with, along with Delegate Ken Kerr and a crossfire with Senator Benson, is the Interstate Social Work Licensure Compact Bill. How many of you know that that is so important? I happen to represent District 26 in Prince George's County, Maryland, and guess where I am? I'm right at the Virginia line, literally. And you know that Maryland also, some of my colleagues are right at the Delaware line, right? Wouldn't it be wonderful to know that people who have this experience can use it across the line? Isn't it wonderful to know that if people move to our area or move out of our area and they were able to provide services to someone, that there would not be a disruption in service, that people don't have to keep paying money and money and money to be able to provide services, but that we can have some type of a uniformity where we can make sure that the needs of people are met. And so this interstate social work licensure compact bill allows social workers to deliver care in compact states, those states who have entered into agreement to work together to make sure, again, that the needs of the people are met. This bill is a critical bill, and in order to meet the current demand, replace workers, how many of you know we are losing social workers in the state of Maryland? We need help, and it's okay to say we need help. We also have services that we can assist others with. Why not us work together? Listen, can y'all say now more than ever before? We have to learn how to work together and make sure that the needs of all of our people are met. And so degree completions from Maryland social work master's programs have been declining. Only a small portion of graduates from behavioral health-related programs work jobs in Maryland that are providing those behavioral health services. Again, we have people who are moving away, sometimes just across the street. Can you imagine what it's like to be a person who is in receipt of services and you move, and now you have to have a disruption in your service because you moved out of state? Why not be able to, if possible, continue the service with the person who was working for you, the person who you built a rapport with, the person who knows you, who you know, and who you trust, right? Because again, that's still things that contribute to the stigma and the shame. People don't want to have to keep getting to know new people, right? This interstate social work compact bill helps to do just that. We want to coordinate with states that will work together so that we can see that the needs of our state are met, so that we can, if possible, be of assistance in other areas, but in the end, so that everyone's needs are met, so that there's more opportunities for people to be assured that they can thrive and they can survive and they can strive to do better and do better well. That's what we're here for. That's what these bills do. And I hope that I have answered any questions. If I have not, please feel free if you have any questions. And I don't mind if you just say, girl, you're gorgeous. Any questions? And y'all know that's real for me, because it took me a long time. It took me a long time and many years to be able to look in the mirror and say, girl, you're gorgeous. That's real. That's healing. That's therapeutic. And I want to make sure that a lot of other people who are out there, can I just tell you, this is the God honest truth, that is this year, 2025, that I'm actually proud for the first time in my life to have been born Justina Dorothea Stewart. No questions?
Okay. Well, thank you very much, delegates. We have one more speaker in the legislative portion of the event. And like I said, I may say a couple of words afterwards just to fill in some gaps from some things that we haven't talked about yet. But, you know, I'm going to go back to those those kind of parity and equity issues that I mentioned at the beginning of this At the beginning of the briefing portion of the event, like I said, Marylanders are 9 times more likely to go out of network for behavioral health care versus primary care, a rate that's twice the national average and 4th worst in the country. And so what happens when folks have to go out of network for behavioral health care? They end up paying high out-of-pocket costs on top of what they're already paying for their health coverage. That's where the bill that our next speaker is going to talk about comes in. It helps to kind of protect against those balance billing practices. And so from Dorchester, representing Dorchester and Wacomico counties, Delegate Sheree Sample Hughes.
Thank you. Thank you so much. And when you say my county, it's like, woohoo, yes, I'm excited. I just made the trip right up here and went through all them counties too, just to get here for you guys. But certainly it's an honor to be here with you on today. I've always been grateful for the work that you do and the work that you continue to do, because this is not a one-stop shop. This is not something we can just stop and say we're finished. We'll never be finished. But I hail from the Eastern Shore, and being in a rural community, certainly it has its challenges all by itself for access. And when I was able to come into the House of Delegates and start out on the Health and Government Operations Committee, and Speaker Bush asked me, he says, "Are you okay with this committee?" I was like, "Yes, sir, yes, sir." Like, what else would I not say to the speaker, right? But no, I think he knew where my heart was just on things that I've worked on in the past, even before coming to the legislature, and knew that my passion could even grow even more in that particular committee. And in doing so, I found that I've been able to be successful and help reduce barriers and really get to the root of what we need for our communities. And it is not possible without your help. Oftentimes, when I see people, they're coming to my office in Salisbury, they'll see the award that I've received from this very same event. They'll say, "What is that? What did you do?" I say, "Oh, you really want to talk about it?" So I had a lot to say. But the work continues, and I stand before you today about the particular bill that deals with balance billing. Just as Dan had indicated, we want to make sure when people have to seek care and in behavioral health and substance use disorders, that they have access, that they have the ability to be in their area, in their community, to get those services. And if they aren't there, then they should not have to pay so much out of pocket that they can't even think about getting any type of care. Because you really have to do that balancing act. It's like, well, is this important, or do I keep the lights on, literally? And so it wasn't until a city councilwoman who was in Salisbury, she now resides in Montgomery County, but she came to me and she says, "My grandchild just needs services. What do we do? We're up to like $4,000 in bills. We can't afford this." And balance billing came into play. I understood as people say, I understood the assignment, but I understood what that meant when she broke it down for me, that her grandson needed care, but they could not afford it. And so what was brought to the table, we were able to, after a lot of fights with the carriers, but we were able to get to the point of, if someone has to go out of the network to get care, should they have to pay additional, or should they have the ability to pay the same as if they were in network? And so gratefully, things have improved, and we were able to pass that legislation about 2 or 3 years ago. Where we are today, and this is House Bill 11, and you can certainly follow it, but it's House Bill 11, and then in the Senate, it's Senate Bill 902, sponsored by Senator Augustine. But what this does today is to remove that sunset. So we can say that this is standard practice, this is standard business, and we are going to continue to stand on business to make sure that we can get people the care that they need, and then for them not to have to constantly figure out what that looks like. In this process, I met with the carriers, and they understood certainly this is where we need to go to be able to provide that level of access. But we also want to make sure, and these are some of the tweaks to the bill, we want to make sure that they're continuing to get the treatment that they are in need of, that they're not having to stop treatment and then start up again, and then start up again, That, as you heard from our previous speaker, my colleague, that isn't, the consistency isn't there. When it isn't there, then you have even more challenges. You have that trust factor that becomes huge issue. Someone may not want to even walk back into treatment, let alone the cost of everything. But that very ability or inability to be able to stay with the same practitioner, it plays into that. So we were able to take care of that in this bill as well, and making sure that the consistency and the continuation of care continues. Now, our carriers are certainly of the mindset and know nationwide that it is a challenge to find providers in this space, but they have work to continue to do as well. And we as a group here need to make sure we continue to educate so we can figure out how do we get more people into serving as providers, but also making sure that they're equitably funded as well. That's a concern at the same time. So as I said, we have a lot more work to do. I currently now serve as the chair of an organization called Women in Government. It's a group of women legislators throughout the entire nation. And what we have opportunities to do is to replicate good bills, good legislation. And every year that we come together, we have an opportunity to have what we call is bill share. And we're also doing some through webinars, but it's been able to be replicated throughout the states. So as I said early on, our work continues to be done, but just know that it's not just here in Maryland. I'm working across the entire nation. My colleagues are working across the nation, so we can make this something where people are not having to be stressed about whether or not they're going to be charged out of network because they don't have a provider down the street from them. So with that being said, access to healthcare is key, and I know it's key because I know in my own life growing up at 16, when I didn't know that I was going through depression, some people were like, oh, are you on drugs or something? Like, what? How about I'm just a teenager that needs some help? How about that? And you didn't know. It's just some things happen as you grow up, right? So what it is important for me today until forever will be that we can make sure that people are getting the resources and getting the access they need. We break down some of these barriers and we make our communities stronger. Strong and resilient communities is what this is about. And even more so today, we need it. I talk to people on a daily basis. In particular, I talk to my sister on my 2-hour drive up here. But she works for the federal government, and she's stressed. She's crying. I don't know how much more I can help. She's asking me about, where does she go get care? This is how significant it is, so more so today than ever. So keep doing what you're doing, and let's work on things together. We put the pressure on, and we're going to get the change that we need. So thank you for your time today. Thank you for allowing me to share about House Bill 11. And the good news is that it is out of the subcommittee. The bill is on the main committee of HGO, and so they should be voting it out maybe today or tomorrow. But let's keep up the good fight, and thank you again.
All right. Well, so that is we're kind of wrapping up the legislative briefing portion of the event. We're going to get to the awards soon. I did have, again, just a couple more comments that I wanted to make before we switch to the awards. And it's something I mentioned earlier about school mental health funding in this year. So for folks that aren't aware, recent data that came out from the state shows that 36% of Maryland high school students report as being persistently sad or hopeless, with 1 in 5 of those students and 1 in 4 middle school students having seriously considered suicide over the past year. And despite that, the proposed budget for the current year would reduce the annual budget for Maryland's Consortium on Coordinated Community Supports. And for folks that aren't aware of what that is, it's something that was created in the Blueprint for Maryland's Future bill a few years ago. And it provides grant funding to schools and jurisdictions across the state to expand mental health and substance use disorder programming in those schools. And like I said, it would cut, the budget this year would cut from $130 million to $40 million annually, that funding. So that's a $90 million cut in services, 70% cut in services annually. And, it's just devastating. After several delays, the consortium just became operational last year, but it is already having a tremendous impact. In just the first 6 months, The consortium has provided mental health resources to more than 58,000 students across 80% of all Maryland public schools, and showing improved mental health outcomes for 70 to 80% of those students that it's serving. So it's a critical need. A cut this large would be devastating to the schools and jurisdictions across the state that just got this program and these services up and running last year. And so, again, it's another thing that we're going to have to fight. It's a difficult budget year, but I encourage all of you to kind of help us support this. There's some other budget issues that we're facing around crisis response services being underfunded, around community behavioral health services being underfunded. But we're going to be trying to bring everyone together to, again, show a kind of groundswell of support around opposing these cuts. On March 3rd, that's a week from today, the Behavioral Health Administration budget hearing is March 3rd. And you have buttons on your table for a reason, because we want to make sure that it's a kind of a day of visibility in Annapolis. We want to bring as many people down as possible to show, again, how important these services are and how opposed the community is to these budget cuts. And so out on the registration table, there's a little sign-up sheet for those of you that can come down on March 3rd. We don't have exact timing yet, but if you can come down on March 3rd, if you're interested in getting more information, please sign up on the table, out on the registration table, and we'll follow up with an email over the next week or so. And yeah, you can come down here to Annapolis and help us fight these budget cuts. So with that being said, I'm going to turn it over to Linda to start the awards portion of our event. And thank you very much.
This is always the most fun part of the program, at least for me. And I do want to acknowledge, I know there's a number of people who have come in late and are probably going like, where's Waldo? What happened to that panel? I don't see any chairs up there. No sign of a speaker. And that is for those that are late, because our speaker unexpectedly is sick and could not fly here from Yale to do her remarks. We will be scheduling that at a later time. You all will be invited, and that will happen after sessions. So in the meantime, we are going to get started with our awards. And again, thanks for everybody's patience with the last minute change. Dan and I are going to present these awards together, and I am going to ask him to come up to present our first award. Oh, shall I do our second award? Would you want a minute? It's okay. Sorry about that.
Yes. All right, I'm back. So I have the honor of giving out our Legislator of the Award this year to Senator Katie Fry Hester. Senator Hester was elected to the Maryland Senate in 2018. She has represented Howard County and Montgomery County since then. She currently sits on the Committee on Education, Energy, and the Environment. And in her time as a member of the Maryland General Assembly, Senator Hester has spearheaded numerous initiatives to ensure that individuals living with mental health and substance use disorders can access services that most appropriately meet their needs. In 2023, she was the Senate sponsor of Children's Behavioral Health Coalition priority legislation that's helping to improve, as you heard earlier from Deputy Secretary Alyssa Lord, that's helping to improve Maryland's programs for delivering high-fidelity, home and community-based wraparound care to Maryland youth with intensive behavioral health needs and their families. And like I said, as you heard from Deputy Secretary Lord earlier, that work is underway to implement that legislation, and we're seeing, we're really excited about the what will be happening to kind of expand access to those services. Senator Hester was also the lead sponsor of legislation that established the Maryland Behavioral Health and Public Safety Center of Excellence, which is helping to develop systems across the state designed to divert individuals with behavioral health needs away from the criminal justice system and into treatment. Among her many successes, however, Senator Hester's biggest impact may be felt in her work to expand access to school behavioral health services. Obviously, I just talked about this since leading the effort in 2020 to ensure that the landmark blueprint for Maryland's future public education reform bill adequately addressed the mental health and substance use needs of school children across the state, Senator Hester has worked tirelessly to ensure the appropriate implementation of that effort. As a member of the consortium on coordinated community supports, and her passion and her work with the consortium is a big reason why the more than $110 million was allocated in late 2023 to expand behavioral health access in public schools, and it's, like I said earlier, it's already having an amazing impact. The RFP for the next round of grants was released this past December, and it's historic. This is a historic, non-lapsing fund that is really helping to ensure that our students are prepared and well-positioned for academic and future success. And so we just need to make sure that we protect the funding this year. And like I said, so meet us out on the 3rd to help protect that funding. But help me give a big round of applause to our Legislator of the Year, Senator Katie Frey-Hester.
Well, thank you, everybody. This is I'm really honored to be here today. And I'm really humbled to receive this recognition of what has really been an amazing team effort. I mean, really, there are so many people, in addition to these two wonderful people standing on the stage, who I'd like to thank. First of all, I wanted to give a special shout out to everybody who was involved in passing the Blueprint for Maryland's Future, and specifically the Consortium on Community Support Partnerships. Leadership from the Senate President, Bill Ferguson, Speaker of the House, Adrian Jones, and bipartisan colleagues on both sides of the aisle helped to make that happen. Second, I saw a few consortium members stand. If you're in the consortium, can you stand up and just be recognized? There's at least one. Larry. So there's Larry, and there's 25 other wonderful consortium members who really have worked tirelessly over the past 2 years to get this funding out the door. They're supported by two fabulous staff in Mark Knuckler and Lorianne Moss, who really have bent over backwards to get this done, as well as Chair Rudolph. And last but not least, my husband couldn't make it today, but he's the guy who really keeps me sane. And so I wanted to give a shout out to him. He keeps us all, the house running on time, and girls are happy when I'm down here in Annapolis. So this award is really only possible because of all those other people. Partially because our keynote speaker isn't here, I thought I would just take 2 minutes and talk about a few other things. I've always been deeply committed to really expanding mental behavioral health. And some of you know this, some of you don't, but it's personal for me. When I was in high school, I had an eating disorder, and I was really depressed and partially suicidal for 3 or 4 years. And it's only because, my parents, took me to therapy every week, once a week for 3 years, that I'm a success story, That and a few good drugs. But coming out on the other side of that, I'm just looking back, I remember being in high school and being afraid to raise my right hand in class because I thought it was too fat. And then at the top of that was the pressure to get good grades and to make it into a good college. And then I look at my own girls. They're wonderful. They're just wonderful kids right now. They're 15 and 19. But I look at them and their peers, and I think, wow, they have all these pressures that I had when I was in high school, plus so many more. I mean, mass shootings in schools are like a thing. And then there's the cell phones, which hopefully will ban. But they're not a way to connect, they're a way to intimidate. And there's cyberbullying, peer pressure, and it doesn't stop when the school bell rings. And so I really have felt that it's just so important that we do everything that we can, even before COVID, do everything we can to provide our students the support that they need through the school-based system, because that's where everybody has access to these services. And so, as Dan mentioned, in 2020, we drafted a 10-page amendment to the Blueprint for Maryland's Future, which added this partnership between the community and the school system to develop these high-quality behavioral health services when they're needed most. These grants have done amazing things. My legislative director back there, Jalen, raise your hand for a second. He's got a summary of what the consortium has done, which he can pass out. But just like in the past 6 months, between March and October of 2024, through these grants, we provided 60,000 students with behavioral health services. We hired 475 new people to provide the services, and we trained 2,000 staff, in our schools to really help support all of our kids. And depending on what level of service they were at, each of these 60,000 students, 70 to 80% of them demonstrated improvement in their behavioral health in just 6 months, and that is what is possible. Just to give you a few examples, these programs go all over the entire state of Maryland. In Prince George's County, the April-May Company received a grant to support early interventions for learners with intellectual and development disabilities. The Shepherd-Pratt Health System received over $12 million to work across counties, Frederick, Howard, Montgomery, Washington, to support students in all those schools. We allocated across the state tens of millions of dollars for substance abuse treatment and recovery, so our kids really have the right mindset to thrive in school. And understanding that, we have students who are actually parents, and success in mental health starts at home, we funded parental support services through these grants in Dorchester, Frederick, Howard, and Montgomery counties. And friends, this is what happens when all of us take action. It's what happens when we show up for our kids. And that's why, this fight isn't over. The 2025 Budget Reconciliation and Financing Act, affectionately known as the BRFA, it didn't just cut this program to $40 million. It cut it permanently. This was a commitment that we made to fund up to $126 million every year. And this budget cuts it. And so that's why it's so important that you come out and advocate to maintain that funding. If you know people on budget and tax, if you know people on appropriations committee, if you know people on leadership, whoever your senator is, call them, email them, let them know that we are just starting to see changes in generational behavioral health. And we need this funding to continue to make it possible. And it's not, the way we've structured it so that each school or local region has a hub, and the providers come out like spokes. They're from the community coming in to support. You can't do that with $40 million. It just doesn't work. It's a scale thing. We need $126 million to get it done. We can sustain it. Like last year, we had a small cut. We can probably get through this year. But long term, we need to see that $126 million conserved. And so thinking about this, I've got another bill that I'd love you all to pay attention to. As some of you may know, I chair our Joint Committee on Cyber, IT, and Biotech, and I've been really concerned with data privacy as well. Senate Bill 904 takes a stand by imposing a 6% tax on data brokers. Who knows what a data broker is? These are the large companies that take your personal information on Facebook and online and sell them for marketing purposes to serve you ads. They are not currently taxed at all. If we tax them at 6%, my estimate is that we will start to achieve $342 million in 2027. That is a lot of money. And they're part of that. In my mind, they're part of the problem. So we might as well tax them. But in Senate Bill 904, I say that once we pass this tax, that $126 million should go in a lockbox to funding for the Maryland Community, I can't even say it, it's way too long, but the Partnership for Maryland Community Health Supports. And so I'd love to have any of you write in to support Senate Bill 904 as well. In closing, I just want to say that, I mean, you all are here because you know that our children deserve, a future where mental and behavioral health is prioritized and services are accessible. And I'd like to thank you all as the dedicated advocates and service providers who stand there on the front line and make this happen. The work that I do in the General Assembly, I mean, it's only possible because of, folks like you who show up and do the work on a day-to-day basis and advocate for good policies. And so, part of this award is really because of all your support. So thank you so much for what you do. And I look forward to continuing to fight with you to ensure that this funding is sustained.
Senator Hester, I love that idea about the data bill. I think that's a wonderful strategy. But I also want to thank you. There are people in this room, myself included, who have spent 3 decades fighting for that school mental health funding. And honestly, when we saw what was there, what you were able to get for us in that huge education bill, I mean, it really was like a dream come true that finally there was a reasonable amount of money to meet the needs of our kids. And so it was, and last year we were all worried because it got cut for a reasonable reason because of underspending. But I think it made all of our hearts sink when we saw what happened. So I just want you to know that it is a #1 priority for all of us. I also want to acknowledge you and Delegate Woods, who came before you, for telling your story. I mean, this obviously is an audience that gets it like no other, but it's hard to get up and talk about your own personal experience. And every time somebody does it, it touches someone else out there who realizes it's okay to get help or to be honest about what's going on with them. So I just want to thank you for having the courage to share. Our next award, we present every year our Child Advocacy Award. This is presented in honor of Paula Hamburger. She was a longtime leader in our organization and the broader community. She was an exceptional woman. I'm glad I got to meet her. She became a social worker nearly a century ago when Herb worked at the Mental Health Association. Just kidding. During the Great Depression. But it was a time when few women went to college. And she quickly distinguished herself as an advocate, a community organizer, and a clinical social worker. She got involved in mental health advocacy and played a role in founding our Baltimore chapter. And that was at a time when society was reckoning with the horrible conditions in psychiatric hospitals. She was small in size, always impeccably dressed, polite but pointed, and a stickler for proper grammar. She loved her because he had perfect grammar, always. But she was a force to be reckoned with when it came to her passion. And that passion was meeting the mental health needs of children. Paula was a larger-than-life personality who inspired so many advocates who came after her. She was not someone who suffered fools or who was willing or able to accept an unacceptable status quo. She combined advocacy, community outreach, a keen intellect, and reason in a way that got things done. I don't typically share her story when presenting this award because there's so few people in the audience anymore who remember her, but this year I was asked about her by one of our awardees. I think it was the first time anyone ever asked me, so I thought I'd tell the story. But it was nice for me to think back to my early years here and how much I learned watching Paula in action and what a difference she made for half a century in her quest to improve the lives and conditions of our youngest Marylanders. So tonight, we're recognizing 2 tremendous child advocates in Paula's honor for their unparalleled and long-standing leadership in ensuring that the youngest of the young are not forgotten, Kay Connors and Joyce Harrison. So when I came to the Mental Health Association in the late 1980s, the organization was in the throes of a battle with Paula and a few other advocates who are here in this room at the center of a fight to gain acceptance of the idea that the public mental health system should serve not just adults, but also children. I'm not kidding. That was the battle. Back then, we were seeking just 25% of public mental health funding to be earmarked for kids, and that seemed like a very big ask. I don't remember at any time during that conversation that we were talking, Kay and Joyce, about 0 to 3s or 0 to 5s, just wasn't happening. But certainly, there were those parents who knew that their babies and toddlers needed help, and they were having those conversations, or trying to, with a healthcare system that had little to offer them. Kay and Joyce have devoted much of their careers to being a force for change in altering that tragic reality. It has been a long, slow, but wonderful road of trailblazing leadership and tenacity on their parts to ensure that the mental health needs of our youngest Marylanders are properly cared for. Kay leads the Center for Infant Study at the University of Maryland, and Joyce is an early childhood psychiatrist at Kennedy Krieger. They have a long list of credentials and accomplishments in establishing best practices in care for our little ones. And all of this is noted in that little booklet you have at your tables. But what I'd like to do here is just try to bring some of that work to life. Of course, they've been collaborators and leaders in our state's early childhood steering committee, which began when Al Zacek led the children's division at the Mental Hygiene Administration, and that brought us, among other things, an early childhood certificate program to build essential workforce capacity. At every juncture along the way since, in building capacity and competency to serve infants and toddlers and their families, Kay and Joyce have been present, improving assessment, diagnosis, and treatment, of course, but also tactically and relentlessly figuring out how to drive change so that it gets to families in a way that works for them. Joyce leads Project ECHO, which makes sure that pediatricians in rural and underserved parts of Maryland receive teleeducation so that they can deliver best practices. Kay's work was recently featured in a Harvard Science by Design program. Kind of a nerd, so I watched that webinar last week because I wanted to see it. And I was so impressed with the evidence-driven approach to this work and the engagement and empowerment of all key stakeholders, preschool teachers and staff, parents, including recognition of dads, which is so often ignored, clinicians, caregivers, and the community networks and programs that young families rely on, particularly those with the greatest need. So both of these nationally recognized leaders have been creative in deploying new ideas, testing them in partnership with stakeholders, and continuing to assess and recalibrate to maximize results for our youngest Marylanders. They have taken this thoughtful approach one step further as leaders in the creation of the Maryland, D.C. Association for Infant Mental Health, which is part of an international movement to create a comprehensive and uniform workforce endorsement program to further strengthen capacity to serve our youngest citizens. It's hard to imagine how many little ones and their families have benefited from Kay and Joyce's guiding hands. Thank goodness for these two remarkable leaders who saw the need and have devoted decades to doing something about it. Paula would be proud. Please join me in celebrating Kay Connors and Joyce Harrison as our 2025 Paula Hamburger Child Advocates of the Year. We have to take a picture. Oh, I'm stealing your bell, Joyce. Okay. Oh. Thank you. And actual bell.
Thank you. That was so, you stole half of what I was going to say. But that's okay.
We'll say it
no,
again. They're not always listening by this time anyway.
No, it's impressive, Linda, that you knew so much about what we've been doing. We are so grateful to you guys, Linda, Dan, and where is Ann? Is she in the room? She's outside, because I want to say a little bit about Ann and how she's really, Kay and I have been working together for, 25, 30 years, sometimes in the same place in Maryland, sometimes across the city at Hopkins in Maryland. But we have figured out how to complement each other rather than duplicate each other. So I'm going to say some things, not everything, and then Kay's going to say some things. So I wanted to say that I am so grateful to the Mental Health Association because you guys have really propelled us to from invisibility really in the state to prominence to the point of really bringing foundations together to fund the work we're doing in the Infant Mental Health Association. I'll say a little bit about that because we have time, right? No, I won't say a whole lot, but particularly Ann. So I don't know, Dan, you were the chair of the Behavioral Health Advisory Council. I don't know how many years ago, 10 maybe. So I joined the Behavioral Health Advisory Council just so I could know, what is the state funding? What are they doing? Because, I'm this clinician toiling away. And it took me several years to figure out what the hell was going on there because I don't know anything about policy, advocacy, any of it. But anyway, they said, you got to join a subcommittee. So I joined there's Ann. So Ann, I want to give a shout out. So I joined it's called the Child, Youth, and Family Subcommittee because I'm an infant and preschool psychiatrist. I'm like, that's where I'm going. And so Ann Getty said to me probably 2 years in, what exactly is infant mental health? And then she was like, this is amazing. And then she started saying, you need to teach people, you need to tell people what you do. This is so important. And it is, and Kay and I know this. But what is so wonderful about Kay and I sharing this award is that I'm going to tell you guys what is infant mental health, what's infant and early childhood mental health, the definition. How many of you know how many of you could answer this question if I said, what is infant mental health? Good. So I'm going to teach you guys. And I can't help it. I'm a natural teacher. It's what I do. But so there are really kind of three basic parts of good infant and early childhood mental health. The first is the ability to form secure relationships. So it's all about relationships. The second is the ability to express and regulate emotion. So you can tell that when these things go wrong, you have all kinds of behavioral and mental health problems. And then the third is to be able to grow and learn in safe environments. And all of that has to happen within the context of your family, your culture, and your community expectations and values. So it's a lot to have good infant mental health. It really takes a lot. But the first thing that I want to say is it's about relationships. It's all about relationships. And as you look around this room, we all know that all the work gets done because it's all about the relationships. Several of the senators and the delegates said, talk to the people you know, show up, be there, right? Work together. Hi, Janice. I just saw you in the back, right? So I'm looking around and I see all the people that I've crossed paths with, and it's amazing. So it's especially meaningful. I don't know how often you guys give this to two people together, but it's ever? One other time. So it's especially meaningful to share this with Kay, because Kay, I have work wives and work sisters and partners in crime. I couldn't do anything without Kay. Kay is behind me saying, you need to talk about this. Can you talk about that? Can you go to these people? Can you do this? And seriously, so many times in the Infant Mental Health Association work, I have fallen apart, and she's been there to push me up and say, stand up, you can keep going, you can keep going. She's going to talk about our partnership. But anyway, we complement each other. We really, we bring different strengths. I've been running around talking about the science, and she's running around talking about the practice and how important it all is. So anyway, I don't know. When Kay stops working, I will stop working. So because I won't be able to do it. So thank you guys so much, the association. I also want to thank the Behavioral Health Administration, in particular, Delisa, who was one of our founding members of the Infant Mental Health Association, which I'll say one quick word about, because we have our whole table over there. Our infant mental health people are all here. But just Delisa has been just an incredibly huge supporter, both emotionally, financially. She was the original president of the Infant Mental Health Association, and then when she got her job at BHA, they made her quit, and I had to take it over. So, and I was not prepared to take it over. And now we have the lovely Brianne Fellows, who's taking over from me finally after I've been like 5 years past my expiration date. So I am so excited about our new leadership and the funding we've got. So the Infant Mental Health Association is like the mini mental health association. So our role is really training, advocacy, and policy. And we're just 5 years old, but Kay will talk about some of our exciting funding. So the Infant Mental Health Association and the original founders, and I want to thank Claudia Remington, who got this award last year, helped us draft our bylaws, was huge, one of the founding members. Jeanette Guerra, Carrie Gorkas, who was our third kind of pillar to hold up the stool as we were building this association, and Carol Norris Shortle, who was one of the original, like 30 years ago, Infant Mental Health Association members, and Melissa Rock, who many of you know, whose job is advocacy now, who was our original membership chair. And all of these people really drove this association in the beginning, and now we have new leadership taking over. So just those are sort of the thank yous, and thank you, Anne, for putting us in front of everybody and making infant mental health a priority in last year's report for for BHAC, or maybe it was 2 years ago, but this year for the association to really make it a priority, and to hear about these bills for early intervention is just amazing. Personally, I want to thank my work family at Kennedy Krieger and the ECHO work that I do, and actually Antonia is here, one of my ECHO teammates, but Mary Leppard and Jana Steinberg, who couldn't be here tonight, but without whom I couldn't do my work at all. And then, and finally, I want to thank my husband, who tolerates, patiently listens to my rants, and I think secretly and maybe not so secretly respects my passion. So thank you, John.
Because you're gorgeous.
I love that. Oh, thanks so much, Joyce. And thank you, Linda and Dan and Anne and Heidi, if she's here, for all that you do to make children's mental health matters. I encourage everybody to join their incredible campaign and keep so much of what the delegates were talking about today. So many of those bills were really about children's mental health, so you guys have really helped us come a long way in Maryland. We really appreciate it. And as Joyce was saying, it really is a special honor to accept this award together. Joyce is a dear friend and a dear colleague. I've learned so much from her. We've traveled all around the state together. And the world. Yeah, and the world. Oh, yeah, we even went to Ireland together. Yeah. We were in Ireland together. Really listening to families and providers and really trying to support that partnership, that relationship-based work. And for many years, we would, kind of swim upstream together the best we could. And when it was hard, we would just text each other, just keep swimming. And sometimes we would also have wonderful moments of celebrations, just little wins. And we would say the same thing, just keep swimming, because it does make a difference. And sometimes you feel discouraged, sometimes it's hard to see the light in the darkness, but having a friend and a colleague and someone who's really passionate about the work really helps to keep my light burning about this work. And I really want to second what Joyce said about the new leadership, which is right there over in that table. We have Bree Fellows, Jessica LaTorra, Shanique Rogers-Henry, Antonia Gerard, people that are taking this work to the next level, and that means a lot to us. We've been holding it for a while, and being able to pass it on and be advisors to the new generation that want to do the work means a lot, especially to me, because 12 days ago I became a grandmother, and so, yeah. And so my husband and I are really grateful that there's people in the world that are delivering science-based information that really stand up like Paula did for reason and partnership and moving things forward for the health and safety of children, especially now that we have such a precious little one.
So I'm not sure if any of our infant mental health funders are here, but really because of this partnership with the association, because Anne and Dan really lifted the work to the foundation community, and then we did as well through other mechanisms, they really stepped in to help us get the association to the next level. So soon you'll be hearing about the new executive director, that we have that funding for 2 years. And up to now, it's just been all volunteer-based work. So getting it to a place where there's some staff that can move it forward is really important. So special thanks to Brooke Heisel at the Krieger Fund and Betsy Krieger, as well as the Richmond Fund and the Sherman Family Foundation are the folks that are believing in that vision. So just on a personal note, it's really special for me as a social worker. I am the person that asked about Paula Hamburger because I'm a social worker. And I also noticed many of the discussions today were about foundational social work things. You all might call it patient-centered care. We call that social work. Actually, social workers were the ones that really started that work. So it's really an honor to hear how we're working together, transdisciplinary, across communities, to really kind of all focus on the same thing and start to have some shared language to mean the same things, to move it forward. So I just want to thank my amazing leaders at the University of Maryland, Department of Psychiatry, our chairwoman, Dr. Jill Rockbeisel, Sarah Edwards, our division director, Gloria Reeves, and Nancy Lever, who's also here, are people that really show up every day, always make decisions about what's best for patients, what's best for the community. And so it's that kind of partnership, I think, that helped Joyce and I form our partnership across the city, across universities. We are stronger together, and I think when we work in that way, we really do move things forward. So my last personal note, I would say it really means a lot. When I came to the University of Maryland, our then chair said, our job is to serve the citizens of Maryland. I thought, I have found my home. My grandfather served in the Senate, and I have a family that really has served Maryland over decades and generations. And so this is just my small way of keeping that family history going. And I thank my mom and my beautiful daughter for being here today too, my husband.
And now, it's Lori Doyle time. A shortened program leaves us with plenty of extra space for roasting and toasting Lori. And we know she loves that. So, Lori, don't worry. We'll do the roasting a little later in the trophy room down the hall. Here, we'll do the toasting of someone that I and many people in this room have had the honor and pleasure of working alongside for decades to drive change for people of all ages through her work as a lobbyist and change maker extraordinaire. We could not be more grateful for Lori or think of a more deserving individual to receive our Distinguished Service Award. Going to ask Herb Cromwell to come up here in a minute and join me in honoring Lori, but first, I want to say quickly how much I personally have appreciated Lori over the years and how much of a cavern she has left in the mental health advocacy community since she retired. There are so many big battles we all won together and fought over many years. There are so many times I can remember when I would pick up the phone and call Lori about the latest, greatest crisis, to get her take, to strategize together, to laugh at one of her salty or colorful or inappropriate responses. I'm sure some of you know exactly what I mean. And to see how quickly she had already come up with a game plan for the problem of the day. I miss those calls, Lori, but I bet that you don't. Her footprint is there on every big battle that I can remember over the last 3 decades: funding, the carve-out, Community Services Trust Fund, provider reimbursement, keep the door open. But let me get another advocacy giant up here, Herb Cromwell, to share a few stories and celebrate Lori and thank her for her lifetime of service to this community.
Thanks, Linda. It's so good to be part of this tribute to Lori. Lori and I worked more than 20 legislative sessions together. First for MAPS, the Maryland Association of Psychiatric Support Services, and then for the CBH, what became CBH, the Community Behavioral Health Association of Maryland. There were a lot of hearings, there were a lot of meetings with committee chairs, committee members, committee staff, a lot of hallway conversations with friends and foes. In all of them, I got to tell you, I was happy to let Lori do most of the talking. It's true. The reason I say that because from the very beginning, I think we started doing this in the mid-90s, I think. I could tell that Lori had a gift. She was a gifted advocate, and I think it's in her genes. Her dad was a well-known lobbyist down here, Jim Doyle. Her brother is a lobbyist, or was a lobbyist. Was an Uncle Corky was a lobbyist. Yeah, Uncle Corky. So I mean, it was sort of genetically predestined that Lori would be as good as she was as a lobbyist. Now let me talk about lobbying a little bit. You know, lobbying can be a dirty word, but it's really not. A good lobbyist is really an information source, and Lori was a master at it. Good lobbyists, like good journalists, boil difficult, complex issues into words that busy people can understand, including legislators. That was Lori. She did it with honesty, because if you're an advocate or a lobbyist and you're not honest, people will find out and you'll lose your credibility immediately. And that never happened with us or with Lori. That doesn't mean, however, that she didn't put a bit of a spin on our arguments. Sometimes for dramatic effect, tug the heartstrings, that always works. But more often than not, with humor. Lori knew well that if you make legislators laugh, you got their attention. And she did that a lot. Lori, like a good lobbyist, knew when to speak up, and Lori knew when to suck up. It's another key ingredient to be a good lobbyist. You can be obsequious while you're also tough and firm. And she was very good at that, I must say. So for those of us in our field, we were so grateful that Lori spent so many years working on behalf of kids and adults with behavioral health needs, and on behalf of the community providers that I worked with for so many years. Frederick Douglass said, "Power concedes nothing without a demand. It never did, and it never will." Lori, you were a pro at speaking truth to power. We were all the beneficiaries. I know that my job was certainly enhanced by having you as a colleague. So congrats, old friend, on getting this award. Thank you.
Well, I'm so glad we have a truncated agenda here tonight, so that I have full time for my 2.5-hour acceptance speech. I want to thank Linda Raines, Dan, Mental Health Association. This was so unexpected. I think when we went out to have drinks and you sort of said, "Are you coming?" And I'm like, "Well, I don't know," and they hand me this invitation, and I read it, and I had to read it 3 times to get it. So It's very, very odd for me to stand up here. I think anyone who knows me knows my position is always back by the doors, lurking by the doors, catching legislators, stalking them as they come in and out. And I'm sure they miss that. But I'm here today as living proof that dinosaurs still roam the earth. You know, I started down here in 1994 with Herb Cromwell. I'm so glad they brought us both out of mothballs today. That was good. And for younger members of the audience, back then we used to have stuff called paper. True, we used it for everything down here. You'd go to the bill room and get your blue House bills and your white Senate bills. The fiscal notes, all on paper, were crammed into these metal file cabinets on the second floor of the old Legislative Services building. The testimony was all on paper, and you had to make 40 copies for this committee and 20 copies for that, and we were usually blowing the ink drives, and we ran them over to get there in time. So it was a different world in terms of process back then. But as behavioral health advocates, we're facing some of the very same struggles. So I'm sure many of us were shocked and disheartened, to say the least, about the presidential election. And we now face serious budget crunch in the state. But here's where dinosaurs come in handy. We really do, once in a while, come in handy. It's sometimes very encouraging to look back at where we've been and how far we've come. Back in 1994, many legislators thought of mental illness and substance use disorders as character flaws, if they thought of them at all. The mental health budget was routinely held flat or cut, and most of the money was spent on institutional care. The substance use budget was almost non-existent. Providers went for decades without rate increases, even to keep up with inflation, and commercial insurers denied behavioral health care with impunity. So it's good to see that a lot has changed for the better. Now there's a much greater knowledge and recognition of behavioral health and the critical role it plays in overall health status and healthcare costs. The behavioral health budget has increased, and community services are now appropriated the lion's share of the money. And providers, thanks to our legislative champions, and a big shout out to Senator Guy Gazzoni, have seen rate increases over the past 8 years, although we still lag far behind other components of public health. There's a much greater scrutiny of commercial insurance practices and laws that provide teeth for compliance, and you've heard earlier, it's still a work in progress. But the fight isn't over. We have the ongoing push to end the health choice carve-out for behavioral health. It's like Groundhog Day. I mean, we've been fighting that same battle since 1996. Unbelievable. And we have to ensure that behavioral health is last in line for any upcoming budget cuts. But I know this group will prevail. I've got great confidence in this group. After all, we survived COVID. And even worse, Optum Maryland. So I've exceeded my 2-minute testimony limit time. Wait for the buzzer to go off. So I'll stop talking, but I want to again just thank Linda Raines, Dan Martin, the Mental Health Association for this really unexpected honor. Thanks to my better half, John, who called himself the Annapolis widower for all these years, and also met me at the door many times with a glass of Chardonnay in his hand. Thanks to Bert for coming out, Herb Cromwell. He taught me everything. He really did. He taught me everything. I didn't know a damn thing about Annapolis. So thank you for spending that time. And thanks to Shannon Hall for giving me the opportunity to do what I loved full time, and to Nicole Grainer for taking up the mantle. Good luck, Nicole. Thanks to CBH and all the providers out there who do such remarkable things every day, and to our legislative champions who have supported us along the way. And finally, thanks to all of you for letting me be part of your team for so long. Appreciate it.